Hi everyone, welcome to USMLEowesome. In this video, I'll be talking about US Clinical Experience, which is one of the best parts of the journey. Let's start off by talking about why do I need USCE or US Clinical Experience? Well, personally, the experiences you get are very enriching. You get exposed to a different healthcare system, which might be very different from what you have experienced back home. It's a really good professional experience. And it's basically just expanding your horizons. You're meeting new people, you're making new friends, and these friends are from different countries, different states from your countries, and it's just a cultural amazingness that you get exposed to. And you get to live in the US while doing your US clinical rotations, and you can really assess for yourself whether you would fit in this new culture, and can you live in this foreign country long term. Do you see yourself working here, and do you really want to do a residency in the US? Now, these are personal experiences that are nice to have, but remember that USCE is also required in your residency application. Most residency programs require 2 to 6 months of USCE, 2 months being the minimum. USCE is also where you get your letters of recommendations from. Once you rotate with US attendings, and if you've impressed them enough, you can ask for a letter of recommendation to support your application, and they would be happy to write you a letter if you've performed well. A minimum of 1 letter is required, though some programs might ask you to upload 2 or even 3 letters from US attendings. A maximum of 4 letters can be uploaded, but usually one is from an attending back home, usually the head of the department or the head of the unit. USC is also a gateway to a number of opportunities, like research opportunities, just associating with people who are in the same field and who are in the same path as you, who are senior to you, people you can get guidance from, etc. etc. So USCE is amazing and it's a must-have on your application. There are 2 types of USCs. Some are done before you graduate. These are known as clinical electives, clerkships, sub-internships, acting internships. For simplicity for this video, I'm going to refer to them as electives. And there are USCE which you do after you graduate. These are usually observerships and externships, but I'm just going to refer to them as observerships for simplicity. So during an elective, what you do is, just like you're a medical student back home, you act like a 3rd year or a 4th year medical student in the US and are expected to perform things that US medical students do, which is going on rounds, being assigned a patient, taking their history, physical examination, writing their notes, following them up, following their orders up, etc. etc. Observerships are slightly different because most observerships do not allow you to have physical contact with the patient. So you're only allowed to take history of the patient, and that's it. And then learn by observing clinical interactions. They're considered extremely inferior to electives. So, if you are a medical student and if you have not graduated, I would highly recommend that you go for electives rather than graduating and going for observerships. You can read up on the types of USCE on these links. And here's a question that I get often is deciding where to apply for electives and which electives to apply for. So there are a lot of lists available online on which universities give electives for international medical graduates, and you have to select a few places from them by whether or not you fulfill the application criteria for that university. For example, some of them might require a step one score, and if you don't have the score, you're not eligible to apply for that university. Some might have TOEFL criterias, like they might require a speaking of 28, and if you do not have a speaking score of 28, you cannot apply for them. To research on electives, you can just type the college name and then add visiting medical student and Google it and check out their requirements and their application deadline, etc. Usually, most electives would require you to apply 6 to 8 months prior to the start of elective date. However, they would confirm the elective only 2 to 3 months prior to your elective start date, which may be a little annoying, to be honest. Which electives to apply for? Well, it's preferred that you do electives in this field that you want to do residency in. For example, if you want to do an internal medicine residency, then you should apply for electives in internal medicine or subspecialties of internal medicine such as cardiology, pulmonology, etc. But any US clinical experience is considered an experience. So if you do a surgery elective or a pediatric elective, even though you are interested in internal medicine, that's fine too. People from a particular specialty relate more to people from the same specialty, so it's easier to relate to an internal medicine letter writer. If I was an internal medicine program director selecting candidates for my residency program. However, a surgery or a pediatric elective is not considered as a complete waste. In fact, I did a surgery elective and that really helped me in my application. I got a strong letter from them. The attending even recommended me. So yeah, even though same specialty is preferred, it's not a compulsion. And if you end up doing an elective from a different specialty, it's fine. Electives require tons and tons of paperwork. So there are some requirements by your medical school, and then there are the other requirements. You might require a step one score. An application form is just given by the university that you're applying for, and they might require a sign and a stamp from the dean of your college approving you for your elective. Most universities also require a transcript. A transcript is something that is given by your medical school. It basically tells the university what you have done so far, how your curriculum is like, which year you are in, etc. A dean's letter might be required by some universities. It's a letter of recommendation from your dean stating that you're in good standing in their medical school. Some universities might also require letters of recommendation from med school professors back home. So you basically go to your head of department or your head of unit and ask them for a letter of recommendation, or any professor. Some of my readers have asked me what a strong letter of recommendation is. A strong letter of recommendation does not necessarily have to be long. It can be short, but in that short letter, really shows strong attributes and has personal examples of how you excelled in your rotation and how you are just awesome. There are a lot of formats for strong letters on the internet, and you can refer to them because sometimes your professors might ask you to draft a letter and then they would review it and sign it based on what you've written after making changes to them. And making that draft is a tough process. Really writing a letter of your recommendation for yourself from someone else's perspective is hard, and good luck with that. A CV is required by some universities again. Just write your scores, write what you've done, any volunteer work, any conferences that you've attended, any quizzes you've won, any competitions you've won, any conferences that you have organized in college. Everything can be in your CV. I've uploaded my CV for electives on medicawesome.com and I'll put a link to it. So check it out. Feel free to refer to it and have a nice, consistent format for your CV. Letter of intent is like a personal statement. It basically tells why you want to do the elective and why you opting for their university. Other application requirements might be application fees, which is kind of limiting sometimes because the application fees are crazy. It might be $400, $200, and that really limits how many places you can apply to. A TOEFL score. TOEFL is basically an English speaking exam. If you are fluent in speaking English, you really don't need to prepare for TOEFL. But at the same time, some universities require a minimum score of 28 and 25 out of 30 in each of the test criteria, like speaking, reading, writing, and listening. So do not take TOEFL too lightly. Immunization is another thing that is required. You might have records of your pediatricians. If you do not have records, then you can always get your titers done. These titers prove that you've been immunized. A police clearance certificate is also required by some universities like Cleveland Clinic and Case Western. You have to get a clearance from either the dean of your college or by the government. B1, B2 visa is required for doing electives. While going for the visa interview, you should remember that you're not going there long term. You're not planning to settle there. You're just going for your electives. And it's important to realize that when you go for your visa interview, mostly you will have acceptance letters from universities that you've applied to. So take all these letters, take the letters and application forms of places you've applied to, places that you've been rejected from, and places that you've been accepted from. It shows that you are a serious student who wanted this US clinical experience. You can also take your CS exam permit. Step 2 CS exam can only be given in the US, and it's a great time to give your Step 2 CS exam immediately after electives, because then you're used to the clinical interactions between patients in America. Health and malpractice insurance are also required. Malpractice insurance is kind of expensive. You can ask for the elective coordinator to have these documents after you're accepted for the elective. What I did was I applied for these insurances and paid for them. And then when I did not get accepted, I asked for a refund. There might be other documents that are required, and you can check out these links to find out more about these documents. If you're not accepted, be prepared for this possibility. I had applied for my electives. I'd applied late, which is partly the reason I did not get accepted for any electives the first time I applied, and I was really disheartened, and I decided not to pursue the USMLE journey after that. But be prepared for the possibility. Apply widely, apply to backup places. Maybe the first time you apply, you just apply to places that were big universities or universities that give scholarships, and it's really competitive, so you may not get electives. So apply broadly. Sometimes when you're not accepted to places that you wanted to go to, you might have to resort to paid private companies that offer clerkships. These are American clerkships, AMO opportunities. They do ask for fees that are higher than usual electives, but it's another way to get US clinical experience required for your residency application. If you're accepted, congratulations. It's a video for another time on how to perform well in your rotations, how to study for Step 2 CS, how to ask for a letter of recommendation. Rotating in the US is fun. Um, it's a different cultural experience. You dress differently, you walk and talk differently, the interactions with professors are different. It's just amazing. So that is it. I hope this video was helpful. Let me know if you have any questions or if you need any help with the documentations required for electives. just email me and I'll try to help you as best as I can. And stay awesome.